Well, have you ever thought about how important your feet are if you're experiencing pain, whether it's in your feet or other parts of your body? Your feet, guess what? They might be out of alignment. Well, there's a way for you to find out for free, and I'm going to tell you about that opportunity in just a moment. First of all, Dr. Dan Bangart is with Peoria Foot and Ankle Specialist, and he's here to tell us what you will be looking for at this free screening. First of all, let's talk about a very common problem that people have with their feet. What is that?
Well, the problem is called hyperpronation.
Okay.
And hyperpronation is where a foot is just not as stable as it needs to be, and it collapses when we walk on it.
Is that something that we're born with or something that's created over time?
Well, I tell most of my patients that all foot problems can be avoided by picking your parents more carefully.
Okay, well, that's not going to happen, so then what?
So now you need us. And so
right.
It's a condition you're born with, like eye color and hair color. The foot type you're born with is from your parents.
All right, well, let's talk about a procedure that you guys do that actually will correct this foot alignment. But before we do that, I want to show some pictures of really what we're talking about. This before and after picture, that clearly, and that problem on the left, the misaligned foot, I do see that a lot.
You can see that quite easily, and then we call that the too many toe sign. If you look on that left picture, you can see that fourth and fifth toe kind of sticking out, and then with a properly aligned foot, the toes aren't visible anymore.
Wow, wow.
And so you can look at your own kids and determine that.
Yeah, sometimes you can see, especially little ones.
Sure.
It's very clear. Now the aligned foot, that's after the procedure that you're going to show us.
Or sometimes you just pick your parents carefully enough and have that foot from birth.
Our darn
but
parents.
This is kind of showing a pre-op and a post-op, and so on the left-hand foot you can see what a collapsed, hyperpronated foot looks like.
Now, and a misaligned foot can cause a lot of other problems, not just sore feet, right?
Oh, absolutely. When your foot is not aligned properly, it goes right up the chain.
Yeah, look at that. You can see all the way to the knee, to the hip, even to your neck.
Even to your neck.
No way.
Because with people with bad feet, you can just see their shoulders out of alignment. That's one of the things you can tell.
And that can be a problem from your feet.
Correct.
Who knew? All right. So let's talk about this procedure. You brought along a sample of a foot or an ankle here. Tell me about what is this procedure called and how does it work?
Okay. The procedure is called a HyProCure stent. Hyperpronation is our problem, and so the HyProCure is the cure for that.
Okay.
And so probably 60 years ago, we had things called orthotics, and probably everybody's had orthotics. We see them available in stores and things like that. The way to think of an orthotic is like an eyeglass for your foot. They work well.
And something like, and you're referring when you say an orthotic,
so
you mean something like this. Okay.
Yeah, typically is a custom art support designed for your foot.
All right.
And so the good way to think of an orthotic is like eyeglasses. Eyeglasses work great and work great for years and helps people see, and then orthotics help people walk.
Okay.
The HyProCure stent, which is shown here, it's a little titanium little implant. It's designed to go in a certain spot in the ankle joint, right in there, and it corrects that alignment internally. Think of it like LASIK for your eyes, rather than
so you don't need eyeglasses
anymore. You don't need eyeglasses anymore.
Interesting.
So a HyProCure will eliminate the need for orthotics.
Wow.
And align the foot from the inside.
And it's, you can tell in a very simple screening. You're going to be doing some free screenings coming up. When people come in, how do you determine if they are a candidate for HyProCure?
The best way is just to watch them walk.
Really?
We watch them walk, and then we do a simple range of motion exam, and you can tell very quickly.
And what about kids who might be misaligned? Can this procedure work for them as well?
You know, this procedure was designed for kids. This type of procedure has probably been around for 30 years. The problem with the older implants and things that we had before is they were tolerated well in kids but not in adults. The reason I love HyProCure so much is I can use it in my adult patients as well as kids.
Okay.
And there's no damage to joints or other things. The older implants, sometimes we had to drill into the bone to put them in place. The HyProCure is a very simple procedure, does no damage. And I love it. It's just a boon for my patients. It's much more tools to work with.
All right, so you know, you might be sitting at home going, you know what, I think I've got that problem. I think I'm a little misaligned. Well, here is how you can find out for free. On Saturday, July 19th from 10 a.m. until 2 p.m., you can go to Jump Street, and they have two locations. One is in Chandler, one is in Glendale, for your free family foot screening. And while you're there, you will have a chance to enter to win a 2-night stay at the JW Marriott which is an almost $700 value. And if you pre-register, you'll double your chances to win. Here's where you can register. It's alignmyfeet.com/Phoenix screening. You can also walk in if you don't pre-register. And when you do that, when you show up, you'll get a free 1-hour all-access jumping session. That's a $15 value right there. All right, to find out more, you can also contact Dr. Dan at Peoria Foot and Ankle Specialists. And here's his website, feetshouldn'thurt.com.